Here are a few items that are helpful to have at the bedside when doing colostomy care. Um, Most importantly here, or one of the more important things, would be a pair of scissors needed to cut the wafer and resize your wafer. The ostomy nurse recommended the stub nose scissors. As you can see, one leg of the scissor has a stub nose and the other has a piercing leg. So make sure that this is the scissor that you use. It's as the ostomy nurse said, Rhonda, she recommended that it will help prevent you from piercing the pouch while trying to cut the wafer. These scissors are called OR scissors, SB sterile 5.5, and can be found in our Pyxis. A bar of soap. It is actually dial soap and is the soap recommended for when you want to use warm soapy water at the stoma site. Make sure that when you're using these soaps that all of the residue, soap residue, any kinds of creams and all of that are completely removed from the site before beginning to adhere the wafer, or it will cause the wafer to easily lift up if any residue of soaps or creams or anything are left at the site. A straight tip Yankauer is also very helpful if you have particularly watery stool when you're working with the patient. Again, our Yankauers can be found, our straight tip Yankauers can be found in the Pyxis, and very recommended for, again, the watery stool. And don't forget to bring the line for the Yankauer. This line will attach from the Yankauer to the suction canister at the wall. And last but not least is the Mepitel 1. This was a product that I had that I'll feature and just have a brief presentation with regards to its use when we had a particularly challenging patient. My colleague Velchi Hermosa discovered that this really helped to keep the pouch nicely sealed to the patient's skin, and in turn, Roshni Patel showed me exactly what Velchi had discovered, and it worked really well for the patient. So just another item that might be helpful in cases where patients have some difficulty keeping the colostomy bag adhered to their skin.